Okay, breast cancer screening and prevention and all the situation. Generally, we screen breast cancer at age of 50 up to 74 using a mammography every 2 to 3 years. Here is 2 or 3 questions. If the patient is 75, no screening. Why? Because it is not cost effective anymore. You only do test if there is an masses or something like this. And 2 to 3, the most common is 2 years. So in any question, you will start as 50 every 2 years. So if a patient is 60 years old, come asking for a screening, you will guide her for mammogram. Is there any exception for this number, 50 years? Yes. We can start at 30, but in a special situation we are going to speak about, like if there is a strong family history or if there is a positive BRCA genes. So we are going to explain now. First, most of the cases has no identifiable risk factor. So yeah, generally, no risk factor for cancer breast. Yes, I understand that there is genetics, there is family history, there is smoking, there is otherwise, but the majority of the cases has no risk factor. You must know this. It is the most common cancer affecting female. Around 13% of females get breast cancer lifelong. So like from every 9 females, 1 will get breast cancer, unfortunately. There is 2 genes responsible. There is more than around 7 genes responsible for this, but the most important 2 genes we need to understand is BRCA1 gene and BRCA2 genes. BRCA1 associated with 65% of breast cancer and 40% of ovarian cancer by age of 70. Meaning, if a female have BRCA1 genes, there is a chance that around 65% that she will get the breast cancer. This is a very high percentage. And also she will get ovarian cancer by around 40%. BRCA2 gene is associated with 40% breast cancer, 10% ovarian cancer by age of 70 also. Here's come a question. If a patient less than 25 years already positive BRCA genes, yeah, we know that she has BRCA, we did a genetic testing. Is there a chance that she get a breast cancer before age of 25? It is very rare, less than 1%. And the golden rule, no breast cancer in children. Like if they less than 18, no breast cancer, no worry. This is a very important. We are going to demonstrate why right now. Now, if there's a children with family history of breast cancer, like her mother have breast cancer, her aunt, her grandma, and so on, what you can do for her? She is a child, like 13 or 14 years. You will start screening right now? No, you will start screening at the age of 30. But which method? You have 2 choices, mammogram or MRI. MRI is more sensitive, but it is not cost effective. So usually we start using a mammography. What about the genetic testing? You can do it starting from age of 18, but usually we do it around age of 30. Test for BRCA genes. Okay. What if there is a woman older than 35? Having family history of breast cancer, also her mom, her sister, and so on. And she come today to the clinic. What you are going to do? As there is a family history, first of all, as she is older than 35, this is a rule. You must do BRCA gene testing. What is the preferred method? We do something called the protein ternication test. Okay. Lastly, if a patient with positive BRCA genes, how to prevent breast cancer? Mastectomy, total mastectomy, bilateral total mastectomy. What kind of prevention is this? This is primary prevention. Okay, what about the screening itself? Screening is secondary prevention. Early detection, secondary prevention. Prevent disease, it's a primary prevention. Early treating is a tertiary prevention. Okay, early treating like before it gets mets or something like this, it is an tertiary prevention. So at the end, let's review the most important. Start screening at age of 50 using a mammogram, no need for hand examination or other stuff. If there is a positive family history, still a child, do nothing, start at age of 30 doing MRI, mammogram, and genetic testing. If she already older than 35 years, you must start with genetic testing, also mammogram. What if it is already having a mass? Like the question asking you about the patient who came today to the clinic with breast mass. It is not a screening right now, it is a management. So you will do ultrasound, mammography, and biopsy. Biopsy is very, very important to avoid any legal complication. Thank you very much.